Something is happening to technology tonight, so you guys bear with me. Something is really happening. Hello, everybody. Oh, here's TikTok. No, it's not. Something is really happening to technology tonight. Anyway, hi, everybody. Welcome to today's live stream. You're so very welcome. Thank you for joining me. Today, we're going to be discussing some of the questions that you, my viewers, have posted into the channel over the last 1 or 2 weeks. And I really appreciate you for doing that. And we're going to be addressing a question around Plan B and whether it works when you're ovulating or when you're menstruating. We're also going to be tackling somebody or a question around somebody who's been experiencing heavy menstrual bleeding with anemia that they've not been able to manage for 12 years. And that strikes a chord for me. I don't know about you guys. And then we're going to have a look at whether tiny fibroids can cause bleeding. These are some of the things we're going to be addressing in this live stream tonight. So hopefully you're going to gain something from at least one, if not all of these segments. But I'm really glad that you've taken the time to join me tonight. If you've been enjoying these kind of Q&A sessions that we've been doing since the beginning of the year, please give this video a like. And of course, consider subscribing to the channel. That would be so much appreciated. And of course, go ahead and check out the description box. I will probably update it, especially if you're on YouTube. I'll probably update it just as soon as the live is done. But some of the useful links you'll find are the links to our website where you can join our mailing list. And this is speaking to you guys on TikTok as well. You can join our mailing list for a monthly newsletter packed with helpful tips. Actually, it's going to be weekly now. We've just changed the schedule for the newsletter. So it's actually weekly newsletter. You can use our free symptom checker for guidance on any health concerns. And you can send an email health inquiry for a customized response. And very soon, I'm really excited, in the next 10 days or 9 days that we're counting down, very, very soon, there's something new that's coming to the Ask Away Health platform. We're partnering to get something new for our viewers to help with medical information, medical guidance. I'm really excited to share this with you guys, but that will be in another week or so plus. So yeah, before we get started for tonight's session, let me just remind you and put our disclaimer up that this video is meant for educational purposes, not intended to replace medical advice or provide a diagnosis or treatment. We're simply having a conversation around health-related issues. I encourage you always, please speak to your medical provider, the person who knows your medical background, the team who knows your medical background, so they can provide information and guidance and treatment that is specific to your own health condition. Thank you so very much. So let us get started with the very next, or the very first question, now that we've done all that official business. And it's a fairly simple and straightforward one that we're starting with. But let me say hi to you guys on YouTube, Facebook, and LinkedIn. Hi to you guys on TikTok. I'm going to be reading out the question for you guys on TikTok. Don't worry. You guys on Facebook and LinkedIn and YouTube will be able to see the question on the screen. And of course, I love to hear from you in terms of comments or questions around the topic, any contributions that you have. We're all learning together. So let's start with the very first one, which is showing up on the screen and says, Doctor, I have been bleeding for 2 weeks now since I've had the 2-rod implant. What do I do? So this was interesting when it came to me, because I'm not familiar with it being referred to as a 2-rod implant, which I don't see why I'm not familiar with that. But of course, the implant has had different evolutions since it was first introduced. So you've had, was it the 5-rod implant? You've got the single-rod implant, and you've got the 2-rod implant. So simply referring to that form of contraception where the implant or the rod is inserted underneath the skin, usually in the arm. So this lady is concerned about bleeding for 2 weeks. And, literally, this is the only information that we have. She's been bleeding for 2 weeks since having the implant put in. And the question is, what do I do? I mean, on the face of it, you could quickly answer that. I think this is probably the simplest of the questions that we have to tackle tonight, because the question is really, a couple of things. You could go back to your doctor would be the simplest thing, or go back to your provider who put the implant in. But seriously, I think there are a few things to learn. There are a few education points around it, which is why I brought it forward as a question. So basically, the implants will work similar to other birth control methods by suppressing ovulation temporarily, okay, and then thinning the lining of the womb. Remember, it contains progesterone. Having irregular bleeding is common, okay, because of the effect of the hormone, the womb lining becomes a little bit fragile, and so you might have unpredictable shedding or bleeding. And a lot of people, I would say over 50% of people using this method would experience irregular bleeding, whether it is bleeding that's not expected or bleeding that's heavy or spotting or different things in the first 6 months of having the implant inserted, and it tends to improve generally over time. And that is why most of the time when you have this method, your doctor or whoever, or your nurse, whoever is having it put in, will counsel you about what to expect. That's the ideal. You should be counseled about what to expect, what kind of bleeding pattern to expect. Now, nobody is going to be able to tell you specifically what type of bleeding pattern to expect, because we don't know your body that way. You can't predict what might happen, but what we can tell you is to expect that there may be a difference. There may be an unpredictable pattern for a few months until things get regular. I think it's good practice, and I'm sure that many of us clinicians who are putting the implant into users will provide that counseling. I think the issue is when the bleeding becomes really quite heavy, or if it's so unpredictable or distracting or just crazy. I think that's when somebody should really begin to question what is going on. So expect that you could have irregular bleeding. However, if it gets to the point where it is very, very heavy, so you're having heavy bleeding, having to change a soaked sanitary towel every hour or every couple of hours, losing floods of blood clots, that's quite heavy bleeding, then it might be important to find out, right, is there anything else going on? You might need to have a blood test. They might need to think, could there be an infection going on? Could there be anything else apart from this implant that's causing this problem? And in some people, you may want to do other tests, including a scan, to find out, as well as a physical examination, to find out, is it fibroids, is it a polyp, what else could be causing this problem? Now, in the event that we don't find anything, in the event that everything checks out fine, no abnormalities in terms of the womb, no fibroids, and so on, then there are a few options. And again, this depends on the nature of the bleeding, which we don't know here. All we're told is that bleeding for 2 weeks. I presume this is bleeding non-stop, but I don't know how heavy it is because they've not told us. Okay, but depending on just how severe or not the bleeding might be, then people might want to think about short-term or long-term fixes. Now, not too long ago, I published on my YouTube channel a couple of videos looking at how to manage heavy and painful menstrual bleeding, referring to using ibuprofen and tranexamic acid, non-hormone methods for managing heavy bleeding. And they could come into play after a discussion with your doctor. They could come into play if we've done all the tests and we've not found anything, and the bleeding is not so severe, it's manageable, but it's just a bit disruptive, it's a bit irritating because you're having to change tampons or pads so frequently and so on. It may be that using a non-steroidal anti-inflammatory drug like ibuprofen might help to reduce the bleeding a little bit. Please go and check out that video. If I remember, I'll put the link, but if you go through my channel, it's quite recent, you can find that video. Or tranexamic, or you could use tranexamic acid. That might be another measure that could be used while you're experiencing that. And this is simply because we've not found any abnormalities. We know that if you are able to persevere with this method, the irregular bleeding does tend to settle down. In some cases, and again, when they've not found any abnormality, your doctor might be happy to start you on a combined birth control pill. this is just to try to make things regular, just to calm the bleeding down, because it's simply the effect of hormones on the womb lining. So there are different strategies that could be considered. Now, of course, if the bleeding is extremely severe, causing serious problems, really bad anemia, for example, because of very heavy bleeding, or it carries on longer than 6-month period, then you might be thinking about switching to a different contraceptive method. So if you're just joining the stream, welcome. Thank you so much for joining. We're tackling the very first question, which I've got on the screen again. It says, Doctor, I've been bleeding for 2 weeks now since I've had a 2-rod implant. What do I do? And the point I'm trying to make in summary is that it's not unexpected to have irregular bleeding. We don't know the nature of bleeding that they're describing, whether it's very heavy or spotting. We don't know exactly what it is, but women can expect different types of bleeding. It varies from woman to woman. And so it depends on how bad it is or how severe it is. If it is, then please go and see your doctor. If it's something that's really disruptive, making you unwell, just causing lots of problems, please go and see your doctor. If it isn't and you don't have any other symptoms, really, it's reasonable to consider waiting, because it does settle down after some time. And we say 3 to 6 months usually. But if it's really disruptive, if it's really causing you to have troublesome symptoms, please go and see your doctor. They might want to examine you, run some tests. If they don't find anything, they might want to suggest some short-term strategies to help to calm the bleeding down while they're waiting for your body to get used to the method. Or if it's really severe bleeding, if it's really uncomfortable for you, then, changing the method is, of course, the next thing to consider. Okay, so not to panic. Please speak to your doctor. We're going to take a quick break. I hope that's been helpful to whoever's asked that question, and anybody who's also wondering the same thing. We're going to take a quick break while I say hi to the guys on TikTok, and then we'll go on to the next question. Okay, fantastic. Welcome back. If you're watching this live, guys, where are you watching from? Join the conversation. Let me know how you guys are doing. What's the evening? It is evening where I am. Let me know what it's like where you're watching from. But let's head on to the very next question. And I'm going to read this out for you guys on TikTok as well. So please listen carefully. I would love your input. Really love to hear what you think. I'm a Christian, so this, of course, touched me when I read this. So this says, hello, I've been dealing with my anemia for years. None of my doctors know why it keeps dropping. Okay. So next she says, let me take away this banner so we can read this properly. Okay. So next she says, I've had iron and IV. I presume she's had iron tablets and intravenous iron. So iron given into the vein. But still her hemoglobin, I presume the anemia was dropping. She says, I do have heavy menses. Okay. That might explain it. And then she says, so my gynecologist prescribes me birth control every 3 months, but even that is not working. Then she says, I have a tiny, tiny fibroid, which they say does not impact it. So my primary care physician doesn't understand why. My hematologist doesn't understand why. My gynecologist doesn't understand why. 3 categories of doctors stymied by this problem. I've been dealing with this for almost 12 years and I'm tired. So this is where, this is a serious issue. This is somebody's experience. And of course, those of you who study the word, who read the Bible, are familiar with the woman with the issue of blood and how she was healed. And I think that was what struck a chord when I first saw this message. But sort of going back to the story, I think it's really distressing. And, you can only imagine the experience of somebody who's having not only heavy bleeding, but experiencing anemia in addition to that, to the point where she's needed to have intravenous infusions. So the levels would have been quite low. And the symptoms associated with that, feeling tired, even more serious complications like breathing problems or, heart-related problems. So it's a serious problem. We're looking at anemia, long-term anemia that's not responding to treatment. We're looking at heavy menstrual bleeding that is not responding to standard treatment that we would, recommend, using birth control pills to try and manage the period, make it lighter, make it less heavy, and hopefully control the anemia by doing that. And of course, the frustration, because this has been going on for 12 years. 12 years, guys. 12 month after month after month, 12 years. So, if I were to sort of look at this, there's so much that, you want to ask. You don't know how old this person is. Even if you want to imagine this started in their teens, so at least they're 30, in their 30s, possibly, or, mid 20s, early 30s. If they're older, then of course it's much older than that. So we can guess at how old they are. We can guess at whether they have any other medical problems. There's so much, that you want to ask. Of course, I also want to know, what else have the doctors been doing? I really, really want to know what tests they've done already, because clearly this is something that she's seen specialists about. This is something that she's had a conversation, not just with her primary care physician or her general practitioner. She's had a conversation with a gynecologist. She's been referred to the hematologist. They've really, really tried to look into this, and I would really be curious to know what that they've done and what tests they've done. I would imagine that they've done a barrage of different tests, but let's just see, what we can add to the conversation. I think the first thing to note is that, she talked about anemia, and heavy menstrual bleeding that is persistent, that continues on and on, can definitely lead to anemia, as she's saying. But there could be other things contributing to her anemia. So, when she said, if you pull this up again, when she said that they gave her birth control every 3 months is not working, I would love to know. So what happened? Did it not control the period? If it didn't control the period and the heavy bleeding continued, why didn't they look for some other methods to control the period? Because if we control the period and we manage to establish her hemoglobin and stop the anemia, then the problem is solved. So something tells me that probably that didn't happen. The fact that they got a hematologist involved means that they're probably doing the next thing I'll be thinking about is, wait, is the anemia being caused by something else? And so that's the next point, that anemia can be caused by different conditions. You can have different types of anemia, not just because of heavy periods. Of course, clearly men can experience anemia, and men don't have heavy menstrual periods. So anemia could happen because somebody is not absorbing nutrients effectively from their gut or from their bowel. For example, if somebody has celiac disease, anemia could happen because of certain chronic diseases. It could be autoimmune conditions like rheumatoid arthritis, even chronic kidney disease, which is why I was saying it would be useful to know what, if any, medical condition this lady had. You could also have something called hemolytic anemia, where the blood cells are being destroyed. So in iron deficiency anemia, which is what you get from heavy menstrual bleeding, you're losing blood, you're losing the blood cells. They're just leaving the body. So there'll be deficiency of the components of the blood cells, particularly things like iron. In the problem with absorption, for example, the problem is that you're not absorbing the necessary nutrients from the gut, from the bowel. In something like hemolytic anemia, that means that the red blood cells are being destroyed. So it's different from the other causes I mentioned. The red blood cells are being destroyed, and that will lead to anemia. And that could happen in autoimmune conditions, or things like sickle cell anemia or thalassemia could contribute to those. There could also be conditions like bone marrow problems that could lead to another type of anemia. So I feel that the hematologist would probably have looked into this, but it's worthwhile us saying, have they considered this? Going back to the heavy menstrual bleeding, is it possible that there's a cause that they've not picked up? And again, I feel it's probably unlikely, but things like adenomyosis, where the lining of the womb is growing inside the muscle, is a condition where you may also have abnormal, irregular menstrual bleeding. Something else that's also close to the mind of the hearts of the hematologist would be if there are problems, medical conditions that can affect other bloodlines, like the platelets, that will just cause people to bleed, without any restriction. So something like von Willebrand's disease is a condition that, you know, may be in the picture. But I'm saying all this sort of thinking that, look, if they've got a hematologist involved, that they've probably covered these things already. The only other thing that she didn't mention is whether she's been seen by a gastroenterologist, and that's a bowel or a stomach doctor, because of course, you know, different bowel problems could explain, you could lose blood through different bowel conditions. And so that may be something that they need to explore if they haven't done that already. Maybe they want to do a camera test, or they want to do a stool test, just to see whether she's losing blood in that way. So what I'm trying to say is, this problem has to be looked at. You have to look at this in different dimensions. There's no easy answer to this, unfortunately. It will need lots of tests, and maybe to go back and ask again, did they miss something the first time around? Is it worthwhile repeating these tests? I can only imagine how much time and perhaps money has been spent on this, but these are just suggestions. So back to hematology, they might want to check, you know, what is her clotting like, look at the bone marrow, and, you know, things that they may not have done already. The gynecology, let's look at treatment, because, you know, I'm quite curious. Let's go back to the question. It says she's got a tiny fibroid, which they say does not impact it. So tiny fibroid. So we're talking about probably between 1 to 2 or 3 centimeters. So really small, maybe even less. And yes, it's possible that because it's so small, it doesn't really affect the architecture of the womb, and so it's not going to cause abnormal bleeding. That's possible. Remember that, you know, different things affect fibroid symptoms. And again, if you're curious about fibroids and how those things work, I do have a couple of playlists on my YouTube channel that, if you're just new to the idea, just been diagnosed, please have a look, because I know that it can bring a whole world of questions. And I don't want you to just think that it's a sentence to illness or sentence to serious problems, or, you know, so on. Please go and have a look at the playlist. But the point I'm trying to make, before I digress too much, is that you could have a tiny fibroid and it doesn't cause significant symptoms, but you could also have a tiny fibroid in a particular location and it could cause problems. So it depends on where this is located and a few other factors. But generally, I would agree that the tiny fibroid is probably unlikely to cause the kind of bleeding that's been going on for 12 years. But the question I would ask then is, have they thought about removing it? And I know this is going to sound really weird, but this is where we are 12 years. We are 12 years. So, and it may be that removing this fibroid may be as simple or straightforward as what they call a hysteroscopy, a camera test looking into the womb, but where you can also have instruments that you can just use to pick out a tiny fibroid. I don't know. Have they had that conversation with her? Is that something that they've tried? Because then, you know, you could get rid of that and then have a look at the symptoms. I suppose the question, of course, would have to be, you know, the pros and cons of the procedure, which is a conversation that she will need to have with her practitioner. The other things, again, now we're talking about treatment, aren't we? We're trying to deal with the heavy menstrual bleeding, because we said birth control didn't work. So I'm saying, okay, you know, removing the fibroid. But there are other things like using heat treatment, or, you know, heat treatment to clear out the lining of the womb to see if that will stop this bleeding. Now, this is endometrial ablation, this procedure I've just talked about. Is not for everybody. Again, it depends on her age, it depends on her intent, whether she still wants to have a family, and other things that she might want to do. It depends on those factors. Hysterectomy is, of course, an option to consider, but it also depends on whether she has completed her family, whether she still wants to have children, and, you know, other things that they would have to consider. So this one is a tricky one. It's a really tricky one. It involves definitely the opinion and the care of more than just one practitioner, maybe a second opinion from, you know, a different group of individuals sitting down, telling the story all over again to see what has been missed, what haven't they done, what else could they be thinking about. So to the lady who sent in this question, my heart really goes out. It's a tough situation. I don't know what you guys think. I don't know whether you guys would have any other ideas or questions. Let me know in the comment section. If you're watching on the replay and this you've had this kind of similar experience, please share with us, how things panned out for you, what your experience was in getting care from your practitioners. It'll be great to hear from you. Okay, guys, so that's number 2 question. Let's take a quick break, okay, and then we'll deal with the next one. Hi, Julia Green. Hi, Yvonne. Richmond's Media. Thank you guys for joining. Okay, but let me just be careful with this before I topple it off my stand. Okay, so welcome back, guys. We're dealing with another question. So let's look at number 3 question. And this one is related to Plan B. So this one says, hi, Dr. Sylvia, I watched your videos. I just tried to tidy up the question a bit. So if you're the one who sent in this question and you're thinking that it's not exactly as you sent it, yes, I know I had to just remove a few bits so that it wouldn't be too long for us to read and understand. But these are the key things. So you had your period on the 24th of January this year, and then it looks like you had sex on the 5th day of your period, the 28th of January. So 5 days. I don't know how long your periods usually are. Presumably that was the end of the period. I don't know, but let's just assume. So at 2 a.m., I suppose on that day, you took Plan B, okay, which is fine. You're supposed to take it within 72 hours of unprotected sex, so that's fine. That is when you can expect it to work as effectively as possible within 72 hours. And then around 12 p.m., the same day in the week, I don't understand this same day in the week, but anyway, around 12 p.m., you got a light bleed. And since then, your period hasn't come. And up till when you sent this message, you said yesterday, the 28th of February, so a whole month after that light bleed, a whole month, you said you had pain in your lower back, you had pain under your tummy. And then the 1st of March, still feeling little or no pain. And you want to know whether this pain that you're getting is a sign that the period has almost come and Plan B has worked. Well, the simple answer to that is, I don't know. I don't know. That's the simple answer, because we don't use any of these to indicate whether the Plan B has worked. At least to answer the second part of that question, we don't use the presence or absence of pain to tell us whether the Plan B has worked. What we use to tell us if the Plan B has worked is either your period has come back or has occurred or has come at the time it was supposed to come, so the date it was supposed to come, or a pregnancy test. And in all this that you said, you didn't mention once that you've done a pregnancy test, and it's been at least a month. Why haven't you done a pregnancy test? So if you're asking me whether your period has almost come, could be. If you're asking me if Plan B has worked, I don't know. I can't tell. There's no way anybody can tell unless you do a pregnancy test. But let us go back. Let us try and look at with the information that you have. The first thing I'll say is that, Plan B tends to be effective when you take it before ovulation. Okay, so at this point, she's unlikely to have been ovulating, because don't forget, she was in the tail end of her period, I presume, or at least the middle, 5 days into her period. So she was at the tail end if she hadn't even, was finishing of the period. But you guys know that I'm not, this period sex thing, I'm not being able to get pregnant during period sex. Again, I have a video on that. It's a bit old, but, the information is still, fairly accurate, because it's not really changed. And because we all have different lengths of our menstrual cycle, and some of us ovulate, and we all ovulate at different times in that cycle. So you can't just assume that because you have intercourse during your period, you're not going to get pregnant. Remember that sperm are going to survive for 5 days. So if you're somebody who ovulates early and you get caught with sperm still alive within you, by the 5th day, for example, you ovulate, and of course pregnancy can happen. So no, I'm not a proponent or advocate of that we don't get pregnant during period sex kind of thing. Please don't do that. So that's one. The fact is, to be fair, the risk or the chance of being pregnant around your period that's probably around the lowest risk, because she's not or she's likely not to be ovulating. That's possible, but I think she was still spot on to take the pill, because the information or the recommendation that we give to you guys is take it at any time of your cycle, as soon as possible after sexual intercourse. We know that it's most likely to work before you've ovulated, but some authorities think that apart from preventing ovulation, it may also do things like thin the lining of cervical mucus thicker, all these things that can prevent sperm from going ahead to fertilize the egg. So the bottom line is, if it is what you have access to, please take it at any time. Take it at any time of your cycle. Okay, so I think that was the main thing I wanted to bring out from this particular question. And then the other thing that you may be, that might be useful to think about is, in this particular, in a scenario where you're really concerned about the possibility of pregnancy, this is, let's ignore when she took it, or which time of her cycle she took it. When you're really concerned, really very anxious, because this is the issue we're dealing with, is the anxiety about pregnancy. In that scenario, you want to go for something that is pretty much very likely to work, and you can take it within 5 days of having unprotected sex, or within 5 days of ovulating, and that's the copper coil, the copper IUD or copper coil. And so that can work up to 5 days after you've had intercourse, or 5 days since you ovulated, whichever one comes first. Now, this business of a light period, some of you might want to ask, what is that light period about? And that's a good question, because after taking the pill, and I have a couple of videos on this, there's 3 possible outcomes, okay? Or is it 4? One possible outcome is that, after taking the pill, things go on same as usual. Your period comes at the expected date, the next period, that is. The second possible outcome is that your period is slightly delayed, or delayed, so it comes in later, and it could be delayed by a few days or a few weeks or longer, okay? And the third option is that the period comes in a bit earlier. Okay, so that's the third option. So there are 3. Okay, nothing happens, so that is no change, things go on as usual. Your period comes in earlier, or your period comes in later. Oh, the fourth one, sorry, I'm forgetting. The fourth one is you have a bleed that is really unrelated to your cycle. It's just a random bleed because of the effect on the hormones. Okay, so those are possible events that could affect your period after taking the pill. And so these are all conflicting pictures. Like, we can't predict who might have the experience of a normal period. We can't predict who has a just light bleed that's not really here or there. It's not a period, it's not a delayed period, it's not a period that's come forward. It's just a random funny bleed, and that sounds like what this lady had. It may be because of the effect of the pill. Now, it's possible that she may be about to get her next period. This pain that she's having, if we were to question it further, maybe she was experiencing cramp, maybe it's a cramp that she's been experiencing. It may be, but at the end of the day, instead of asking ourselves these questions, it would have to be a pregnancy test, because if you do it within 2 to 3 weeks following unprotected sex, then it should tell us, at that point, we should have a test that will show up positive or negative to at least guide us. Because if it's positive and she's having pain, then I would really be interested in understanding, okay, what is going on. With the pregnancy, those are issues. We need to talk about the pain, and then proceed to look at what might be causing it in pregnancy. That's why it's so important to do the pregnancy test. Okay, so I don't know what's happening. I said there were tech issues. Something's happening on TikTok. So let me just end this live, because, yeah, it'll just go off on TikTok there. Okay, let's just go on here. What was I saying? So I think the bottom line is about doing the pregnancy test. Let me add that if she's experiencing severe pain, or she come tomorrow, for example, suddenly starts to have heavy bleeding, so important to do that pregnancy test. Please see your doctor. Okay, please see your doctor. It's so important to do that pregnancy test. Guys, what do you think? So those are the 3 questions I wanted to cover tonight. We've looked at the first one was about bleeding for 2 weeks after the implant, and we looked at the implication of that, what it means, whether to worry, when to worry. And then we talked about this bleeding issue for 12 years, you know, anemia, heavy bleeding, fibroids, and the fact that all these specialists have been involved, and what else could we be thinking about? And we've just talked about, you know, bleeding after taking lack of bleeding. Actually, this last one was lack of bleeding after taking the pill. What do you guys think? Okay, I'd love to hear from you, but this is where we call it a night for tonight. Thank you so much for joining me, and I hope you found this useful. Don't forget that you can look on the website askawayhealth.org, join our community newsletter, lots of really useful information that we're sharing on a week-by-week basis. Of course, you can join our YouTube community here. You're always welcome. Please subscribe. Come on over from Facebook or LinkedIn. Come and join our community here. I do answer questions that you send into the channel as much as I can. Again, I would always say to you that I can't provide you specific treatment or diagnosis on this platform, because that's not, you know, it's not the right thing to do. But the other ways that we can connect, and you'll find those in my description box. Here, we can talk about different bits of information. We can have commentary, we can have debate, we can, you know, look at what might be going on and educate ourselves. So thank you so much for watching. I really appreciate you guys, and I will see you again in my next stream or in the next video, because I do publish that every week on Thursdays. Have a great week, and I'll see you again soon. Thank you so much, guys. Bye-bye. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video. Hi, I'm Dr. Sylvia.